Hello, this is Dr. Brian Adams. I'm an orthopedic surgeon specialized in sports medicine. Today we're going to discuss hip impingement. This is a common cause of hip pain in young and active people. This video will help you understand what hip impingement really is, why every labrum tear does not necessarily need surgery, and what factors may influence your recovery. The hip is a ball and socket joint. In some people, the ball is not perfectly round, or the socket covers too much of the ball. When this mismatch occurs, the bones can pinch each other and cause damage to the soft tissue in between, which are the labrum and cartilage. When the impingement occurs on the ball side of the joint, it's called cam-type impingement. When the impingement occurs on the socket side, it is called pincer-type impingement. You can see it's not just the labral tear that's a problem, it's the bony impingement that needs to be addressed if present to prevent further damage to the labrum and progression into the cartilage. It is not always clear that this is a problem, as cam-type impingement can actually be seen in up to 70% of males without any underlying hip pain whatsoever. This is an MRI of the hip demonstrating labral tear, right where the red arrow is. This is what the radiologist sees after they inject dye into your hip and review the MRI. Labral tears do not always need to be fixed, especially if there is no underlying bony impingement, as we previously discussed. Labral tears can be seen in over 60% of people with no underlying hip pain whatsoever. A labral tear may be a normal part of the hip aging process. Prior to considering surgery, conservative treatment should be exhausted. This includes physical therapy, oral anti-inflammatories, modifying your activities, avoiding high-impact activities, maintaining a healthy body weight, and considering injections when needed. Options for injections include platelet-rich plasma and corticosteroid. You can discuss these further with your surgeon. When conservative treatment fails, surgery may be indicated. In well-indicated patients can see up to 80% of pain relief and potentially delay progression of hip osteoarthritis, as seen in this study. This is why we call this type of surgery hip preservation surgery. The surgery is not benign. The hip is a very deep and tight joint. Consequently, the surgery is much more invasive than routine knee or shoulder arthroscopic procedures. In order to access the hip joint, the patient must be placed on a traction table. The hip must be dislocated out of the socket. This video demonstrates that. Prior to accessing the structures inside the joint after dislocating it, the ligament in the front of the hip must be cut and is the strongest ligament in the body. This video demonstrates that. You can see prior to addressing any of the underlying hip disorders, the hip experiences more trauma than it has ever seen in its lifetime and requires a longer recovery than more simple procedures seen in the shoulder or knee. For this reason, postoperative outcomes can be unpredictable. This is a study of military service members undergoing hip arthroscopy. Note the results at the very bottom that show most patients have some improvement in their pain and hip function. However, 43% of them were eventually referred for medical separation even after undergoing the procedure. The procedure can improve pain. It's not as reliable at restoring military service members to high-impact activities like running, rucking, and marching. For this reason, if you're considering having the surgery, you should also consider a permanent profile, changing your military occupation, or medical separation at the same time, as your outcome may be the same either way. In an effort to improve outcomes, specific indications for surgery have been developed to try to avoid performing surgery on patients who may be at a high risk for doing poorly. These risks include age over 40. At 2 years post-op, up to 18% of patients over 40 will go on to need an early hip replacement. This suggests that doing the hip arthroscopy in this patient age group may make some people not only improve but get worse at a faster rate. Cartilage degeneration and joint space narrowing can also be seen, and these are also bad actors. This leads to conversion to total hip replacement in up to 26% of patients at 10 years. Other poor factors include obesity, borderline hip dysplasia, and failure of a previous arthroscopic procedure. I hope this video provided you valuable information regarding hip impingement and that you understand there is a narrow subset of patients who will do very well after this procedure when well indicated. However, surgery may not be for everyone, and requires an in-depth discussion with your surgeon to determine if it is right for you.